Hello, welcome to my channel. Today we are doing part 2 of admission and interviewing and assessing your patients when they first come up to you through the emergency room. This is the first time you're going to be seeing your patient. This is the first time you're going to be having a relationship with your patients. You have to know what to do before starting this admission and interviewing, what to do before, what to do when starting the interview, and what to know to do during the interview. We are on part 2 and I am on questions and answers. This is part 2. Let's get started. These questions and answers are from RN NCLEX examinations directly. When you're doing your interviewing with your patients, we are continuing what you're going to be assessing, what you're going to be asking your patient. You'll ask the patient, how has the patient's health been changed recently? You'll assess what effects illness has had on the patient's daily function. That's a very important question. Assess what effects illness has had on the patient's daily function. Okay, next question. What are your 3 phases of a relationship? 1, we have the orientation phase. 2nd phase is your working phase. And the 3rd phase is your termination phase. Next question. Your assessment details on your patients can be obtained from where? The correct answers. Assessment data on your patients can be obtained from your senses. Touching, you touch, you palpate for masses, nodules, edemas, skin texture, temperature, pulses, bounding pulse, 3D pulse, weak pulse. You can palpate the bladder for distension. This is how you use your senses to obtain data. Assessment details, we can listen. The nurse listens for crepitus of the joint. The patient moves her legs up and down, for example. You can hear the crepitus, this creaky sounds of the joints. For your vision, you inspect the eyes, inspection of the patient's vision. That's senses. Seeing. We can smell. We use our sense of smell to smell body odors. We use our sense of smell for urine odors, foul smelling urine. That's presence of bacteria. We'll send that urine to the lab for the presence of bacteria, urinalysis. We can do assessments by taking our patients' height, weight, postures. These are all assessments of our patients during admission, interviewing. We are assessing our patients. We do a head-to-toe assessment. Okay, our next question is, what is holistic care? What is holistic care? Holistic care promotes physical, emotional, social, intellectual, spiritual well-being by treating the whole body, mind, and spirit. What are your therapeutic communication skills? The correct answer: applying knowledge to family dynamics. Example, let the family be aware of community resources, community referrals, financial support. Involve the family in planning. Initial health information comes from the client. Involves the family in planning. Initial health information comes from the client. You can ask the client permission to communicate with the family if it's okay with the patient. If you need further information for the client, sometimes the clients are maybe oriented times 2, then you would have to ask the family for additional assessments. The next question is, initial health information from the client is the correct answer. Initial health information from the client is the correct answer. It is problem oriented. We're trying to solve the patient's problem. So we take our initial health information to solve the patient's problem. It is problem oriented. We did ask the patient, what problems brought you here to the emergency room today? The correct answer for initial health information from the client is initial health information from the client can be found in medical records and data containing vital signs. So initial health information from the client is problem oriented, and we can find assessments and information and problems concerning the clients in medical records. Some patients have been previously admitted. Maybe the patient was admitted 2 weeks ago and the patient was discharged 2 weeks ago, and the patient is now coming back to the hospital with the same problem. We can go back into the patient's medical records to find health information on this patient. So initial health information on your client is the question. It is problem oriented. We try to solve the problem that brought the patient into the emergency room. We can get additional health information on our patients from medical records. If your tech just took the vital signs on the patient, we have additional information from the patient's vital sign coming in was 102 degrees. We have additional health information. We can look at that from the vital signs. Blood pressure was 160/100. So health information from the vital signs, from medical records, these are all problem oriented. We are trying to solve the patient's problems. Our next question is initial assessments of your patients. The correct answer on your initial assessments on your patients. You're interviewing your patients, you are admitting your patients, You are sitting at the bedside, you're at eye level, you're talking to your patients. We are still doing initial assessment of your patient, and usually admitting and interviewing and assessing your patient, this takes about half an hour to an hour to admit these patients, because you are trying to find out all your patients' problems. You're asking a lot of questions. You are assessing. Admission, interviewing is assessing. The question is, what are your initial assessments of your patients? Another question. And the correct answer, as we said previously in other questions and answers, we are assessing vital signs. We are assessing height and weight and posture. Does patient have curvature of the spine? Does your patient have we are assessing posture. We are assessing skin color. We need biological data, age. We are assessing chief complaint. What brought you in today? We are assessing what is the reason for seeking help today. What brought you here? We are assessing history of illness. History of illness. Your patient was here 2 weeks ago, and now your patient have to come back here. Plus, we also need to know your patient's history of any chronic disease. Are you hypertensive? Are you diabetic? Do you have high cholesterol? We need to know the patient's history of illness. Initial assessment of your patients. The correct answers are: assess the patient's perception of health. Assess the patient's perception of health. And by doing that, we can know how much education this client will be needed during this hospitalization before he or she goes home. You do not wait for discharge date or when the patient is going home to do education on interviewing and assessments. Admission, we assess patients' perception of health. We need to know, is the patient compliant with medication? Does the patient think he or she needs to be really taking his blood pressure medication? We need to assess the perception. Do you realize how harmful your health has been? We have to start educating our patients from day one. Admission. Assess patient's perception of his health. Assess past medical history. We will assess toxic exposures. Does your patient work in a chemical plant? Does your patient do construction work? We have to do teaching during this admission. Are you wearing masks in the workplace? We have to assess toxic exposures. Some children will come in. Maybe they are in unsafe communities. They have lead poisoning. They live in these rundown buildings. Toxic exposures. Assess smelling of body odors. Assess smelling of wounds. Is your patient a diabetic? Is your patient admitted from the emergency room, coming from the nursing home? Does your patient has these horrible bed sores, foul smelling? If the patient comes into the ED with foul smelling wounds, we have to do an ostomy consultation day one. Let the wound care nurse, she's a specialist in the area of wound care, to come in and assess this wound. And we will do or dressing on this wound, the length, the width, and the depth of the wound, and we will document from day one. Let the wound care nurse to come back in to do accurate assessments on the wound. The wound care nurse will come in to do accurate measurements, the length, the width, the depth of the wound, the drainage of the wound, and there can be a referral to the infection control doctor to come in to see this patient's wound. Then during our assessments, admission and interviewing our patients, we assess for hard sounds. We assess for long sounds, crackles, wheezing. We're talking about our asthmatic patient or COPD patient. These patients may need respiratory therapists to come in and give them a breathing treatment, inhalers. We're going to assess our patient's blood pressure. Have you been taking blood pressure medications home? Have you been compliant with taking the patient may say, well, my prescription ran out and I didn't have any money. So this patient may need social worker to come and help, because this patient is non-compliant because he or she is unemployed. History of smoking. This patient with history of smoking, we're going to assess them. We're going to give them smoking cessation packets. We're going to give the families smoking cessation packets also. They are second-hand smokers. And we're going to do a lot of teaching with these patients who are smokers. Education, smoking, lung disease. We're going to start teaching from day one. Lung disease, high blood pressure, smoking causes constriction of the veins. Those people with high blood pressure should not be smoking. We're going to be assessing their medication. Are they compliant? They are non-compliant. We're going to do a lot of teaching on these patients. We're going to also assess our patients coming in for the use of dietary supplements. We have to document. We have a medication reconciliation list. During our admission, interviewing, we complete our medication reconciliation list, and this list will list all the medications the patients are taking at home, all the dietary supplements they are taking at home. Some dietary supplements cannot be taken with some prescriptions prescribed by the doctor. We'll have to do teaching. For example, patients on Coumadin, these are all blood thinners. No vitamin K, for example. You'll have to do a lot of teaching, so we'll have to document that. For a question on initial assessment, answers are we will have to assess patients for medical devices they are taking home. Patient may be obese. These patients are usually on sleep apnea at home because they have difficulty breathing when they are lying down there. We'll have to assess, do you take CPAP, BiPAP at home? They'll say yes. If they take those machines, we'll ask them to bring it in because the hospital do not have one to supply to all the patients in the hospitals. So we document all patients on medical devices. Do you use a walker, cane, crutches? What kind of medical devices do you use at home? And we're still on the same questions. What are your initial assessment for your patients? And I will continue because you'll find initial assessment on all your patients all these assessment comes into your question and answers in your NCLEX question. You have to know your initial assessment, very important. You'll assess if your patients are using wheelchairs, walkers at home, if they are wearing braces at home. Assess if your patient uses contact lens, dentures at home. You'll assess the developmental stage of your patient. Is your patient 65 years old? Is your patient 3 years old? You have to assess the developmental stage of your patient who you are admitting today. Consider language barrier. Is your patient English speaking? Assess if your patient is going to need a medical interpreter, not family or the tech or the housekeeper to be interpreting. Patients in a hospital needs a medical interpreter provided by the hospital, someone who is competent in medical terminology. Consider your patient's thought process. Is this an old, confused patient coming in from the emergency room? Maybe she's old and confused, because usually old and confused patients, first sign of urinary tract infection is confusion. Assess children. If you are assessing children, you have to know how to approach children when you're admitting them and interviewing. Usually the parent are with them while you're assessing them. The answer is approach children at eye level. As we said during admission and interviewing, you're going to put a chair beside the bed that yourself and the patient can be at eye level. It's very important. Approach children at eye level. Use a friendly voice when assessing your patient. Be quiet, be friendly. Use a friendly approach with children. Speak to children at eye level. And as we said, you have to assess the developmental stage of your clients. Please hit the like button. Please subscribe. Please share your video. Please note that assessment and interviewing and admission of your patients, they all come into one, and there are a lot of questions that incorporates the assessment of your patients during an interview. It is very, very important. A lot of your questions are in fundamentals, are wrapped into assessing of your patients during the interviewing stage. Thank you. Have a good day. Stay blessed. Take care.